Now to Melbourne, to the COVID-19 capital of Australia, and it's a great pleasure to welcome the MP for Higgins, Dr. Katie Allen, to Water Cooler. Welcome, Katie.
Hello, Nick.
You've got a long background in public health, of course, before you entered Parliament just over a year ago. Given your professional knowledge of this field, what's going wrong in Victoria? What are they doing wrong on the public health front?
Look, Nick, I think what's happened is there's been a federal framework and then there has to be a state delivery of services, and the state basically failed here in Victoria. Most importantly was the breakdown in quarantining, but then there's also been this problem with track and tracing. And thirdly, I think that the public health message has been both mixed and not really gone hard early in order to let us open up. It's actually got the messaging all wrong. And I think that's driven by an ideological approach here in Victoria, where Daniel Andrews again and again hasn't been using the expert and the evidence that the national framework has had and has been wanting to go it alone. So I think there's been a sort of a two-stream public health approach, and that's resulted in this mess that we're seeing here in Victoria.
Yeah, they do seem to have a sort of one-size-fits-all policy, that, the same measures apply just about wherever you are in Melbourne, similar measures across much of the state. Surely they can nuance it a little bit better, target it better?
Well, I think that what happened is that they missed the boat early on about understanding this targeted approach. And I think, if they got the strategy right at the head of the epidemic, when it was before it started to grow and become 700 more than 700 cases a day, when it was at 20 cases a day in June, if actually they'd followed what had worked in the rest of the country, which is to get quarantining right, and then if there is an escape of cases from quarantining into the community, once community transmission takes a hold, to have a really targeted approach to get control of that community transmission. So what happened is at the end of June, we were at 20 cases a day, and that's happened in New South Wales, but we can see at the 20 cases a day, they've kept it in control and it hasn't got out of control. It's kind of like, Australia has this quarantine around the nation, which is letting people in from hotspots in a quarantine manner. And if there's a failure or breakdown in that defence, then you need to have a crack team that's putting out the spot fires, which is the escape from quarantine. So when there was a first, what was called wave at the end of March, early April, when we asked Australians to return home, I don't really see that as a wave because we never had significant community transmission. There was a peak because people were returning from hotspots, but they were in quarantine. We knew who they were and we were tracking and tracing and keeping control. So I don't actually see that as first wave. I think what happened in Victoria, which was when there was a community transmission outbreak and it got out of control, that was effectively our first wave here in Australia.
Now, we were just discussing with Oliver Hartwich from the New Zealand Initiative how New Zealand's stage 4 lockdowns don't seem to have made much difference compared to what we did here. So in most of this country we did stage 3 lockdowns. We're in a very similar position if you take out Victoria as New Zealand in terms of the amount of infection and the number of deaths per million. How certain are you that Melbourne, Victoria's got it right and that they haven't gone over the top with this?
Well, I think the first thing to say is, as I mentioned before, is that getting the head of the epidemic right and preventing that sort of second wave would have been great. Now we've taken a lot of measures to get that under control. Firstly to say is that Daniel Andrews put up the white flag with quarantining, passed those services over to other states very early on. He recognised he'd got that wrong. And from what I understand, quarantining involved more clinical interaction in other states, involved the use of the ADF, involved the use of sort of a more military precision with regards to management of that space, you could say. So he realised he was failing there, so he put up the white flag. When it came to contact tracing, it got out of control, and now he's actually, again, put up the white flag. He sent a team up, headed up by Alan Finkel, the Chief Scientific Officer, up to New South Wales to find out what's gone wrong with contact tracing in Victoria and how to learn from New South Wales. And that includes having a decentralised team, which is what they have in New South Wales and haven't had in Victoria. Again, a bit more of a liberal approach than a socialist centralised approach. More of a grassroots decentralised approach in New South Wales works better. Secondly, having a digitalised track and tracing, which they haven't had here in Victoria. I understand it's been very paper-based and very manual, but more than that, not even taking on one of the extra digital tools that the federal government made available early in the course. So he wasn't using the COVID Safe app, and we know that. He's now starting to use that, which is good. And then thirdly, instead of doing this sort of postcode-wide I'm doing a lot of testing mentality, understanding that he had to get every case tracked and traced every day. And Greg Hunt very early on was saying we need every case tracked every day, and we weren't hearing that until we're finally starting to get control now as the numbers are coming down. So what we're doing now as the head comes off the epidemic should have been happening at the end of June. I feel more reassured that those measures are now happening. But instead of saying, right, well, we've worked out what we should do, we're now doing it properly, we're now getting control, he's kind of imposed all these really sort of draconian measures, again, which is a sort of collective approach. Well, you know, we haven't been able to do what we should do, which is quarantine properly and target our tracking and tracing. So let's just collectively shut everything down and, you know, just try for eradication. We failed. Let's try and go again, you know, and try and eradicate and go even harder. And that's really causing a lot of sort of anguish here in Victoria. It's kind of like he's got this whack-a-mole where he's hitting the tail when he missed the head. And, you know, you can see this overreach starting to come into some of the language, but also coming into wanting to extend the state of emergency for 12 months. I wrote a piece saying that as a doctor, you definitely, you know, in an emergency, you have to do things sometimes that are not fully informed from a consent point of view to save someone's life. But as soon as the patient is awake and conscious, you know, consent should never take a back seat. And the same is true for our democracy. You know, sure, state of emergency powers, state of disaster powers are relevant in the acute phase, and that's what the public expect. They expect good decision-making that's expert-informed, that's evidence-informed, and to be made on their behalf. But once things are under control, it needs to continue to be a partnership, and democracy needs to be in the driver's seat. And I think what we're hearing here in Victoria is there's not enough conversation going on with a body of evidence and experts to inform that, you know, robust and quality decision-making, like we saw at the federal government level, where the Prime Minister set up a whole heap of committees with evidence and experts, and then that all fed up to the sort of sophisticated decision-making, which was a plan that included the states and territories, business, health experts from the very start. And of course, he's in the driver's seat and makes the ultimate decision, but he's making it based on an informed and you know, very clear strategy, which has worked in 7 of the 8 jurisdictions around Australia now.
Yeah, because that's right, isn't it? I mean, we expect, in fact, we employ our politicians, you, the Prime Minister, everybody else, to make trade-offs. We're not just to take an expert advice and just pass it on. You have to make trade-offs between competing public policy aims. And it seems to me in Victoria in particular, they've been unable to grasp even the competing policy aims within health. So, yes, sure, you know, there's a job to do in controlling COVID-19, but there's equally a job to do into protecting people's mental health and these other things which one suspects are deteriorating under lockdown.
Well, I think going forward, the sort of state and territory remit is about how do we save lives and the health aspect. But I think they're leaving the job of the economy to the federal government. And while we've said health is actually a partnered approach, I mean, I think the issue is the economy is also a partnered approach. So this whole sort of concept of all we're going to care about is the direct effect of COVID on health and not the indirect effect of COVID on other aspects of health, not just mental health, quite frankly. You know, we know that there's been an increased surge of mental health issues, but the also indirect effect on health itself, because elective surgery has been closed, because people haven't been wanting to go to their GP, they haven't been wanting to get their path test. We're already seeing and hearing from doctors that patients are turning up later and they're turning up with more severe disease. And there's been, you know, great fears that there's going to be a bigger outbreak of things like cancer. So the direct effects of COVID are one thing, but the indirect effects of COVID, both on mental health but on other health consequences, are already starting to build, and we're already starting to see this. So that's why I'd like to see a much more partnered approach of Dan Andrews, and he's now bringing together committees that has the experts in the community, whether it's business or health, about how to have a roadmap of recovery, not a blueprint of misery. or I should say, a blueprint of recovery rather than a roadmap of misery, and how to move forward in a very clear and targeted way. So, for instance, when he stands up and talks about, talks every day to the public, he's always talking about how people aren't doing the right thing. And in public health, you model in, that you'll never get 100% of people doing the physical social distancing that's required. You never get 100% of people doing the mandatory mask that's required. We know that's already modelled in. So focusing on the few percent who aren't doing what they're meant to be doing is kind of a way of moving the blame, I suppose, from what he's not doing, which should be properly tracking and tracing. So we're seeing this sort of shift of, the public are doing the wrong thing, rather than saying, right, we've got to get quarantining right, we've got to get tracking and tracing right, we've got to get the public health message clear and unambiguous, and then we need to partner with business and health about what are the evidence-based things. There's a lot of public health that's not been evidence-based, that seems a bit made up and on the fly. So the curfew, for instance, a lot of the experts are saying, well, where's the evidence for that being a public health initiative that's going to be useful? And then we hear, well, it's easy to police the state of Victoria when there's a curfew. Well, it's the first curfew I think Victoria's ever had. I think we really need to hear evidence that it's going to save lives before you're going to impose something as draconian as that. But then even looking at businesses, people say, why is a gardener who's a sole trader, who's outside, who's not interacting with someone else, why are they not allowed to get on with their business? And that sort of lack of interest in business itself is very concerning, I think, for Victorians.
Yeah, well, your electorate, Higgins, I always think of as somewhere where some of the very best cafes, restaurants and bars in Melbourne are. How are your constituents doing, particularly those in small business?
I've had so many, hundreds of emails and phone calls every day. People are really anxious and angry. To be fair, in the short term, I think JobKeeper and JobSeeker are keeping people afloat, but they're worried about where to from here. I think they've been relieved that the JobKeeper has been extended to March, but they're worried about where to in the future. There are a couple of funny sort of stories, I suppose you say. I had, a local hairdresser rang and said early on that he even though he's allowed to stay open, he wanted to close, and he was lobbying for me to insist that other hairdressers in Higgins were closed as well. And my argument was, well, they're COVID safe in their approach, and if they're willing to provide a service, then as a Liberal, I'm going to be supporting keeping businesses open. And this second lockdown, I'm hearing that from cafes as well. They're worried about the competitive nature, and they're working such long hours. They've had to pivot their business to take away. It's hard to be profitable. I do welcome Premier Andrews' recent announcements about investing in helping keep cafes open by moving them outside. So that's one positive step, where he's wanting to work with businesses to work in a COVID-safe way. But now that we're getting the pandemic under control, I think it's time for him to remodel the numbers he's been looking at, because his modelling was based on the situation being out of control and tracking and tracing not working. But now that he's hopefully moved to a more controlled environment, I'm hoping that he'll redo that modelling and that will open up more quickly. Because at each step, when you push hard on something, you've also got to have the other side, which is open up quickly to benefit from it. In public health, sometimes public health people can get it wrong by doing a little bit is good, a lot is better. And it's very rarely the case in public health. It's usually a balanced approach about not too much of one thing, making sure that you're keeping the balance in the system. And I think that whole strategic approach, which is to balance the health and the economy, is incredibly important, because as we go forward, we'll celebrate the fact that despite Victoria's terrible community outbreak, we still have one of the lowest case rates in the world. And I think that's because of our good original quarantining at the international borders and taking very strong early stand. But we also have one of the lowest mortality rates from COVID in Australia, but also including even in aged care facilities, despite the terrible tragedies that have occurred. It's still a low per capita fatality rate from COVID. Now, that's because we've got a great healthcare system, but we've also got one of the lowest mortality rates once people reach the intensive care. So I don't know if you remember when Boris Johnson went into the intensive care. He was going into intensive care at the time that the mortality rate from people entering intensive care was around 75%. Now, doctors around the world have realised that they were ventilating too aggressively too early. They've realised they can use steroids and they can use other antivirals, and they're using prone positioning. And all of that has resulted in a quite dramatic decrease in intensive care mortality rates. So that at the start of the pandemic was around 75%. In Australia at the moment, the intensive care mortality rate's as low as 15%. I mean, it's still terrible, but it's very, very much better. So we've got the healthcare system has prepared and caught up, and we're now in a better position to deal with it. So we're learning to live with the virus. We need to learn from what we've been exposed to. We were really quick and responsive. We were aggressive in suppression. We had a great strategy. We've had a blip here in Victoria. Now that we're moving out the other side, it's time to take that confidence and open up the economy. We really have to be confident that we can control it as long as we do proper quarantining, proper targeted track and tracing, and making sure that we bring the public with us about what it is we're doing and why we're doing it. And those three pillars and the preparation of the healthcare system behind it, I think means that we should be confident as a country that we really know what we're doing here and we're doing the right thing. So of course a celebration, quite frankly.
Well, Katie, we appreciate your contributions to Parliament and the injection of professional knowledge and wisdom that you've been able to bring to the government during this time. And I know you've been working with Health Minister Greg Hunt quite closely. Thank you very much for that, and thank you for joining us on Watercooler tonight.
Thank you so much, Nick. Great to see you.